The primary physical exam, part 2. Examination sequence. First, we look at the appearance of the patient. So, are they disoriented? What is their gait, posture, and nourishment? Then we look at their nutrition and stature, which at this point we record the height, weight, and body mass index. We then look at speech, which could reveal a pathological condition. There are 5 major types of pathological conditions with regards to speech. There is aphonia, which is the inability to speak. We either lose our voice from overuse or possible laryngitis. Aphasia is the loss of expression of speech due to injury or disease. So possible patient that was in a car accident that has a hard time with their expression of speech very shortly after. As an example, dysphagia is the lack of coordination, failure to arrange words in proper order. This oftentimes happens with patients with brain lesions. The 4th type is motor aphasia, which a patient knows what he or she wants to say but cannot use the muscles properly to speak. This oftentimes happens with our patients that have had a stroke or a TIA. Sensory aphasia, patient pronounces words easily but uses them inaccurately or has a jumbled type speech. This often happens with patients with learning disabilities. Breath odors is the next thing that is examined. Poor oral hygiene or dental care. Acidosis or a sweet smell may indicate diabetes or starvation. A musty type breath odor may indicate liver disease. And an ammonia smell could indicate uremia. Skin. We oftentimes note the fingernails and toenails. Clubbing can indicate heart or lung problems. Spooning of the fingernails or toenails can indicate an iron deficiency anemia, but oftentimes has to be pretty severe to note that. Another thing that skin tells us is proper hydration. We will sometimes do a Turgor test, which helps us indicate the hydration status of a patient. So how this is done is that we pinch the posterior surface of the hand, and if the skin returns back to its normal position, that is a patient that is well hydrated. However, if the skin returns slowly back or there is a delay, that indicates dehydration. Then we examine the head, which how patient handles stress or illness. We also examine whether they have alopecia or excessive hair growth, which could be a hormonal imbalance in women. Then we examine the eyes and the ears. We use Perella for the eyes, which are pupils equal, round, reactive to light and accommodation, is what that stands for. Oftentimes when we are examining the eyes, we oftentimes look at the sclera to see if there is yellowing, which can indicate jaundice or liver disease. When we think of ears, we look in the ears to check for cerumen, and we look to check the tympanic membrane to make sure it is that pearl gray color. Nose and sinuses, we look for mucosa, examine the color and texture. Oftentimes when we look at the sinuses, we'll palpate them and then we will inspect them via transillumination. The mouth and throat, we look at for oral hygiene and dental care. The neck is examined for range of motion, and oftentimes we will check the swallowing, and palpate for the thyroid. We will oftentimes also palpate for lymphadenopathy, for infection. Reflexes are checked in high followers or supine positions. We're checking the patellar reflex and the Achilles reflex most commonly. Chest, we examine the heart, chest, and lungs. In the abdomen, we check for normal digestion or any enlargements of the digestive organs. Breast and testicles examined visually and by palpation. Testicular exam typically falls under this. And then the rectum is important to maintain comfort and dignity. Examination gloves and lubricating jelly is needed. We oftentimes are doing hemoccult tests to test for blood in the stools. Patient positioning. There are several different types of patient positioning. There's followers and semi-followers. Supine position, dorsal recumbent, lithotomy, and Sims are the most common. Followers position is at a 90-degree angle. Usually the patient is sitting at the end of the bed. We use this to examine the head, neck, and chest. Oftentimes the drape is in the lap of the patient. Semi-followers is at a 45-degree angle, oftentimes used post-operatively, patients with orthopnea, and patients with head trauma or pain. And oftentimes the drape is laid across and level with the nipple line. For women, we want to make sure that we cover the breasts totally. Supine position is the front of the body. We use this to examine the heart, breast, and abdomen. The gown is usually open to the front and the drape is even with or slightly above the breasts. Dorsal recumbent position or dorsal lithotomy is used for rectal, vaginal, and perineal areas. Oftentimes patients with back pain will also be put in this position. A lot of times with our elderly ladies that are unable to get into the full lithotomy position, this position will be used to do the vaginal and rectal exams and the pap smears. The drape should be in a diamond shape. As you can see, the drape comes in a peak shape here. This is called the diamond shape of the drape to ensure the most privacy yet the easier access for the physician. Lithotomy position is used for vaginal and rectal exams. We use the stirrups on the exam table. And we guide the patient to their feet in the stirrups and their bottom at the very end of the exam table. It's also important, and a lot of medical assistants forget to adjust the pillow so it is under the patient's head at this point. The drape is also in the diamond shape for this position. The Sims position, also called the lateral position, oftentimes used for rectal exams and installation of rectal medications. Patient will lay on one side, typically the left side, but sometimes the right side depending. But on the left side, right knee slightly bent, and that left arm will be behind the patient. The prone position is used for examination of the back, often used for certain surgical procedures, most commonly in the office, mole removals or cyst removals. Knee to chest position, not oftenly used in the medical office unless you work in the gastrointestinal department, but used for proctological exams. Oftentimes we use the diamond shape for the drape also for this type of exam position, or we use a fenestrated drape occasionally. A fenestrated drape is a drape that has a hole, a small hole, where we are examining that particular patient. So it just exposes that one area. And the Trendelenburg position, which is rarely used in patients with shock or hypotension. Oftentimes, if a patient is in shock or hypotension, has dizziness, we are not trying to get them on the table in this manner. Usually we lower them to the ground and then put their legs up with a chair. A little bit safer and patient-friendly. Principles of body mechanics used consistently in the work environment. Proper alignment begins with good posture. When reaching for objects, do not twist. Turn the feet towards the object. Don't sit with your legs crossed. Principles of body mechanics, so you want to keep the object close to you as she is in A, and you always want to bend at the knees. You never want to bend at the hips, and you never want to keep the object very far away from you. Transferring a patient, focus on correct body mechanics, so bending at the knees. Provide support on the patient's strong side. Keep one hand under the axillary region and one on the forearm. Always bend at the knees and ensure the patient is safely positioned. Role of the medical assistant. Never consider examination to be routine. Have the room, supplies, and equipment ready for all types of situations. Patients prepared, so vitals, height, weight, body mass index, diagnostic procedures are completed and ordered, and restock supplies and disinfect the area. HIPAA considerations. So guard patient confidentiality during all parts of the visit. Place medical records facing the door. This doesn't happen very often now that we are moving to electronic medical records. However, you want to make sure that computer screens are not faced towards hallways or doorways where a patient may be able to see. Make sure they are angled in such a way that patients are not able to see as they are passing by. Place physician schedules away from patient areas. So don't hang the the physician's schedule on the door. I have seen that a lot. Make sure you place the physician's schedule if they require one that they like to look at that's printed out. Make sure you place that on the physician's desk where they can see it and have easy access, and then you have one on your desk.